So welcome everyone once again. This is our virtual town hall with Hiza, Dr. Hiza Mbwana today, and right here, Dr. Physical Therapy. We're going to talk about how functional movement and physical therapy can really help your health, and we'll get into that very shortly after I do a little brief introduction to what's going on in the clinic. As people kind of trickle in here, welcome to everyone. Thanks for spending lunch with us again. And here's our schedule for July. So basically, Dr. Heath is today. We have Dr. Davis talking about fecal microbial transplant and helminth therapy on July 9th. We have Dr. Amina Keats talking about natural prevention of cancer on July 16th. We have Jared Urchek, who's a mushroom expert, herbal expert, and talking about mushrooms for health, medicinal mushrooms. And then we'll have EJ, our very own physician assistant, talking about integrative primary care and how that can really help health and wellness using a comprehensive approach at the end of July. We're also working on in August some other exciting things that we'll talk about as time kind of goes on here. And we're going to rename the town halls actually because now that it's kind of out of this acute setting and COVID's kind of here for a bit, we're going to be focusing more on wellness. We're going to be calling it a wellness webinar. So we're going to be calling this Thriving Thursdays from now on. So we can start with that today with Dr. Hiza. We have a Facebook page. If you're not on that, we welcome you all to join. It's a private page that looks at, we have a public page, of course. We have our private Facebook group that you're all welcome to join. There's patients, there's practitioners, community members that are really into health and wellness. There's a lot of great information on there. One of our members just posted something recently on how they have a 9-year-old, I believe, son that isn't eating very healthily, and like what things you can do to get him to eat healthier. And certainly the challenge that we all have, I think. And I think that was really good. It's really helpful stuff. Nichelle Nation is our wellness coordinator supervisor, and she is taking the new patient calls, and that's for in-person visits or virtual visits at this point. And let's see what else here. So then we're going to go to, so Charm. I just wanted to mention that, I think you all know this, but this is our EHR. So we have been selected as one of 8 to 10 practices around the country. They have about 4,000 plus practices to help be part of their circle of influence, so we can help to steer the direction of EHR to be more to have better service for you. So one of the things that, if you want to type in the chat box, if there's something you'd like about the EHR, if there's something that you want to see improved, in the EHR, maybe a better interface on the patient portal side. I'm not sure what could be improved. I think there are some things, but you could type in the chat box if you have a sense of that. But we're going to be on their advisory board or whatnot. We're gonna, so that's exciting there. Cases for coronavirus. So we know that states that have opened too quickly have basically seen a resurgence. So we want to be still cautious, even though deaths are trending down, new cases have plateaued. So I think they aren't totally trending down, and so we have to be careful not to, I wouldn't go to amusement parks right now, things like that, because that's where a lot of the transmission happens in large groups without wearing masks, basically. So this is a public health catastrophe. This is another trauma. There's a lot of trauma going on right now. The US has 4% of the world's population, but 25% of the world's deaths. About 130,000 people in the earth have died from COVID already, which is a horrifyingly high number, given that we're 4% of the world's population. So we have to think about not only ourselves, but also the high-risk groups, people that, you may not know, sometimes you will know them, but, again, think about others, not only yourself, still do some social distancing and proceed with caution. We've had a number of people also ask about telework letters. If that's medically appropriate, we can provide that. You just have to make an appointment on Zoom with your practitioner. I will brush over this a bit. Oops, wait, sorry. So in terms of research, it's pretty well established now that coronavirus does cause inflammation and affects all organ systems. And recently, in the last week, it was discovered by an Israeli team that coronavirus actually causes blood clots by activating a protein called alpha-defensin. There is one drug that may help called colchicine, and there's still research on how to do that. There's also evidence that vitamin C can help and there's no proven treatments, and there's vaccine research still underway, which is very early. So there's still many unanswered questions for COVID, what's going to happen in the fall, how the virus spreads, the treatments and preventative measures, and even duration of antibody protection has been shown in some studies to be as little as 2 to 3 months. So we can't control that, but we can control our own behavior and our lifestyle practices to be as healthy as possible, to focus on the lifestyle, to focus on the activity, the nutrition, the stress management, and then optimizing vitamin D and blood sugar levels, reducing iron oxidation with vitamin C, and improving immune system strength. So optimizing both physical and mental health and getting through this together is the way to move forward. I will highlight Dr. Hiza here because he's starting on Fridays here at CIH to see people in person, which I'm really excited about. He's starting that on July 10th. And then you see a bunch of other practitioners here and what they're doing. Acupuncture is now open. Carrie's back for MFR, so welcome back. We have also a new test here that I can talk about in a different time called stomach acid testing that our graduate student here, Mukit, is doing, and he's also doing brain scanning and autonomic nervous system testing. So a lot of good things are happening here. We're still using, safe practices with PPE. IV nutrition is happening with Laura and Meg, which is, they're doing a great job with taking care of patients and boosting their immunity. And you can see all the others here too. So we're really focusing today on lifestyle medicine, how to use physical activity to improve your health, because we all know that we've been sitting around more, we've been at our desk more, we've been on Zoom more, right? And then we haven't been outside as much. So how do we move the needle on that to kind of keep getting active, as Dr. Hiza says, to stay active, get moving. And that's all part of lifestyle medicine, which includes mental health and nutrition, sleep, and then a healthy circadian rhythm, and of course not doing excess drugs and alcohol. So I'm going to hand it over to Dr. Hiza here, Doctor of Physical Therapy and owner of Kimbio Physio.
Thank you so much, Dr. Wong, and so good to connect with everyone here. And first, I'm just going to talk a little bit about my philosophy in physical therapy, what we do, what's different, or what's unique about our services. So physical therapy looks at ways to improve overall health and functional activities through exercise, education, and self-efficacy. The challenge for so many of us now with the pandemic hitting is that a lot of the rhythms that we're used to have all changed, right? So we've all lost a lot of the normal rhythms that we've always had, like getting up, getting dressed, going to work, interacting with colleagues. Some of us haven't had that opportunity in quite some time. So that can change a little bit about how we process information. So finding ways to support my patients currently has been a little different than the traditional sense, which is patients will come to the clinic, we would do our assessment, screening, et cetera, do the exercises or do whatever specific movement education we're doing, and then they'd be on their way. So now what we're doing is really, we're looking at how do we develop this new normal? How do we look at ways to create this new normal in as healthy a way as possible? And what we're seeing is that, a lot of folks with polytrauma type patients who have multiple injuries, for example, we're seeing a lot more of their sensitivities kind of coming back up to the surface. And, you're starting to see a whole constellation of sensitivities kind of springing up. And what we want to look at, or what we want to be aware of, is that a lot of these new sensitivities aren't new conditions springing up. It's just the fact that the central nervous system has been so overwhelmed with too much information or not enough information, because our rhythms have changed so much and it's been such a drastic change that it's having a hard time kind of figuring out. So you basically are experiencing sensory overload. So how can physical therapy assist in this process? A lot of things that we do from the virtual side is we look at how does physical activity, how does nutrition, how does mental health, how is your sleep, how is your sleep behavior, how is that? And also more importantly, we're all in this kind of, one contained space now. We're with family more than we ever were before. There's no relief valve. So we need to appreciate all those aspects. So with physical therapy now, especially with the virtual side, it's really not necessarily just looking at here's what works, here what doesn't work, and here's how to fix it. It's really looking at how do we address the whole body, how do we address the whole person, and getting a good sense of what their lifestyle is currently can sheds quite a bit of light in terms of what they or what you can or how you can assist them moving forward. So with chronic pain, for example, low back pain tends to be the most prevalent, and we're seeing it's a multi-billion-dollar pathology that that has myriad of treatments, and it's something that affects so many Americans, and it's so and the information out there is so mixed that we don't really have a strong appreciation of what triggers it, what doesn't trigger. But what we do appreciate is that when it comes to chronic pain or chronic low back pain, there's usually a central nervous system disorder, and the inability to kind of stay focused and kind of maintain a certain level of function can also increase that. And now we're also sitting a lot more too. So the challenge for many of us sitting is that how does that kind of tie into posture, and how does that kind of tie into pain? And we know that the longer we sit, the more fatigued these muscles get. So if there's an underlying issue, or those muscles don't have the kind of fitness that is desirable from someone who's sitting more, yeah, you're going to hurt more, or you're going to find funny ways to wiggle and adjust and try to find the position of comfort. And sometimes in that process, you can stimulate quite a bit of sensitivity to the muscles between the shoulder blades, to the muscles in the low back, and then that can kind of trickle down and create a whole bunch of different symptoms as well. So one of the things that we look at from a virtual standpoint is, how do we manage that sensitivity, and how do we minimize that cognitive fatigue that most of us are experiencing from all the sitting. I can attest to this, because again, before the pandemic, I did some virtual work, but it was nowhere near the volume that I'm doing now. And I can attest to the sheer amount of cognitive fatigue that I experience, especially once I finish. I'm really not very motivated to do any sort of activity after a whole day of spending on Zoom. It's very difficult to stay motivated, and if I feel that way and I'm otherwise healthy and don't have any sort of sensitivities, you can only imagine what it feels like if you do have underlying pathologies, underlying conditions that make that transition even harder. So when people ask me how can virtual physical therapy assist me, the goal with virtual physical therapy isn't necessarily to just dish out several exercises for you to do, but we definitely want to look at how can we manage or create that shift that people can kind of work to develop some level of routine again, because that's the challenge. How do you reclaim that routine? How do you reclaim that rhythm again? And it's the way things are looking now, it's improbable that we'll just go back to our regular routines for quite some time. So most of my work now is spent kind of educating patients on how to make that transition. And the first thing that we talk about or we work on is really how do we increase postural exercises, and how do we create these sort of I call them nudges. How do we nudge people into a different direction in terms of managing their pain? So for example, pain between the shoulder blades, or what we call periscapular pain. Much of that is really not necessarily an underlying pathology, but really these muscles getting weaker and weaker and weaker the longer we sit. So we tend to kind of round our shoulders out, head kind of comes forward. So a couple things that you can do to minimize that or mitigate that is adjusting your screen. Make sure that the screen's at eye level so that you don't always have to look down. The other thing is make sure if your chair has armrests, adjust it so that the arms are just comfortably resting there, so they're not too high and they're not too low, because again, that will also, gravity will trigger some of those adaptive changes as well. And the other thing is just move as much as you can, change positions as often as you can in your workstation. The aim should not be to sit in this kind of erect, what we call good posture, sit in that good posture for as long as possible. The aim should be to change your position as often as you can, so those muscles don't have a chance to fatigue by holding or maintaining that. But here are two simple things that you can do to work on to improve your range of motion. So if I'm going to hold the screen, so basically you're going to start with your palms to your face and your elbows are bent,
And all you're going to do is you are going to rotate and turn your palms in front of you. And what that does is passively pinches the shoulder blades together. So most people will tend to do when they're at their workstation, they'll tend to kind of shoulder shrug or try to squeeze and hold. But the challenge with that is that you can't hold that position all day. What we need to do is work on strengthening those muscles throughout the day. So one great nudge that you can incorporate into your normal daily routine is to just work on increasing posture endurance with scapular rotation. So you start with the palms facing you, and as you turn back, so notice I'm not lifting as far back as I can. I'm just turning my palms so that they're about shoulder, right at my shoulder, and then I come forward again. So I'm rolling back to my shoulder and then coming forward, rolling back to my shoulder, coming forward. And that is a great posture nudge for a lot of people who spend a lot of time sitting for two reasons. One, it encourages movement. So staying active and staying mobile, it encourages quite a bit of that movement. Two, it encourages postural improvement and working on working on improving endurance. And again, it's a low barrier of entry, so it's not complicated. You don't need to get any equipment. And I think that's the other aspect of what virtual physical therapy can do, is that it can help you simplify things, because a lot of times if you're used to exercising regularly, you're thinking, I've got to get my equipment, I've got to get my dumbbells, my weights, my TRX, all the other things. But what we're starting to realize is that every time we're looking for this equipment, it's not available. So we need to find simple things that we can do at our workstation that is easy, doesn't necessarily, and you'll notice I didn't say how many sets or how many repetitions, because that's the other part of this virtual climate that we're in now, is that the same metrics that we used to use, in the traditional setting, which is, hey, do 3 sets of this or 2 sets of this, that no longer applies, in part because there's just no way for us to anticipate that cognitive fatigue that we talked about earlier. So 3 sets of 10 today might be possible, but tomorrow it may not be possible because of a litany of underlying circumstances. And if, as a clinician, we don't appreciate those changes, what's that? Why wouldn't, can you repeat that question? I didn't get that one. Okay. So the next thing that we want to make sure is that we don't set too many limits on movement. So the movement should be just comfortable movements that you can do regularly or daily that don't necessarily trigger any additional symptoms. The next exercise that you can do at your workstation.
Dr. Hiza, I think she said she was wondering, is it okay to move the elbows back beyond the shoulder blades to pinch the?
Well, you don't want to move the elbows beyond the shoulder blade, because then you're going to put a little bit more pressure on this area right here. So the idea is to just rotate back so that the shoulder blades relocate, but you're not stretching the shoulder joint. So yeah, you don't want to stretch the shoulder joint. You want to just rotate back. So my elbows, let me just drop that. So my elbows stay right at my side. Yeah. So as you can see, elbows stay right at your side as you rotate, and they come forward. So they're forward, and you're back. But if you go like this, that's a different exercise altogether, and it won't necessarily isolate the shoulder blade as much. So the next movement is the same motion that we did with rotation, but now instead of the palms in front of you, your elbows are going to be at 90 degrees, and the same idea, you're going to rotate out. And again, what you'll notice, so this is going to target the rotator cuff muscles more specifically. This targets the muscles between the shoulder blades, or what we call the periscapular muscles, and the one at your elbows at 90 degrees targets the rotator cuff specifically. So the impact of both is that they're both tiny, both groups are very small muscles. They've got a very small cross-sectional area, which means that they're more prone to atrophy with disuse, or what we call disuse atrophy, meaning that if you don't use it, you lose it. So we need to keep those muscles engaged on a regular basis to build that endurance and also build the tolerance over time, so that when you do have a stint where you've got to be at your workstation for a significant amount of time, as you get more and more fatigued, you have those muscles behind you to act as resistors so that you can actually tolerate the entire workday without reproducing any of the pain. And then certainly for folks with chronic pain, the idea is that you want to have a variety of movements. And it would definitely give you a little bit more awareness of your postural tolerance as well. And what you'll notice is if you do those regularly, you'll just be more inclined to kind of hold your posture up a little bit more, because those muscles will start to get more fatigue resistant, which means that as soon as you start to kind of melt into your chair, you'll feel those muscles tug. And so you'll get a nice natural cue to unload them. So you'll feel the stretch and you'll just adjust to unload them. Next movement that you can do at your workstation is just kind of, I call it the beach pose. So most of us are living vicariously through old photos of our times at the ocean, but laying, just having your arms behind your head. You're not really doing anything. You're just having your arms behind your head, and you don't need to stretch. You don't need to tug. Just doing this, for 10, 15 seconds, and then getting back to work helps quite a bit, because these muscles will naturally shorten. So your pectoral muscles will naturally shorten, but more importantly, the joint capsule will start to shrink a little bit the longer we're at our workstation. So what this does is it helps improve the overall joint capsular length, but also gives you a little bit of a passive stretch to the pecs. So all you're doing is just hanging there. So the aim is to try to avoid your arms or your elbows in like this. The idea is to just get the arms behind you, and you'll notice when you keep your arms behind you, the shoulder blades will naturally pinch together, whether you like it or not. So these, again, are great simple things that we can do. And to make it a little bit more challenging, you can incorporate this with a walk. So as you're walking, try doing this, and you'll start to feel your abdominal muscles kick in quite a bit. So that's another way to kind of incorporate these movements in different circumstances as well. So we're starting to appreciate more and more, as this pandemic is progressing, that PT and the way we address physical therapy is going to be different for quite some time, but the principles are the same, which is that we want to encourage our patients to find more solutions within themselves and find more opportunities to kind of work on addressing their sensitivities on their own. So we want to educate through learning experiences and movement experiences simultaneously. So it's not good enough for me to just tell my patients during a virtual conference, like, oh, here's why you're having this pain, but it's really educating them on why these movements are so important and how those movements tie into their lifestyle. And so that's really the challenge, is that how do we allow our patients to get out of their own way and start to develop new rhythms? Because this is like we were talking about earlier. This is this period in time is so unique to us and to our society, but also from a clinical standpoint, it's, all factors in terms of self-efficacy, therapeutic exercises, modalities, treatments, etc. There's so many unknowns, and we just don't really appreciate all of the differences and the nuanced processes that are taking place at the same time. So we want our patients, we want to have better education, better consistency. We want our patients to be able to kind of jot down key information and learning resources. So I provide my patients with therapeutic exercises through, so I have a YouTube video channel that has all my therapeutic exercises that way. So our visits aren't really me demonstrating exercise and having them do exercises during the session. It's really, the sessions are meant to kind of go through the movements that we've discussed and review movements and also talk about, what's working, what's not working. Because the other challenge when it comes to moving forward is that we also have to appreciate that not everyone is going to respond the same way to these movements. Not every exercise is going to work. And so we need to play around with the exercise dosage, the frequency, but also, like we talked about earlier, you've got to appreciate every circumstance. So each patient is unique, and each set of circumstances are unique to that person. So therapeutic exercises need to be the same, is that not every exercise is going to work for posture education. Not every exercise is going to work for everyone for low back pain. So the challenge for so many of us is that there is so much more to be done. But in terms of how do we address, you know, neck issues and cervical spine issues, that, you know, those are all kind of, they're all interconnected. And so what we're going to address next is really how do we get, you know, how do we improve cervical range of motion and pain? And the challenges for so many of us with neck pain is that a lot of it can be remedied just by moving more often. So again, like I said, most of us are typing where our heads here. Most of us are either on laptops or are on monitors that are not adjusted properly. So if you're on a laptop, one thing you can do is get either prop it up with several books so that the laptop screen is now right in front of you, and then have a, you know, external keyboard. If that doesn't work, you can prop everything up and then stand up and do that work so that you're a little bit more erect. But in terms of specific for the neck, a great range of motion routine is to take your hand and just kind of grab right between the shoulder blade. So just right back here. And then from there, turning away from that side. But turning away without the body rotating. So you want your arm back here, elbow is out. Just like we were doing that position here, you're just sliding your hand down a little bit. And you're just going to turn your head to the opposite side, and you're going to notice a pretty good stretch in here. So the aim with this is not to crank it and produce as much strain as we can. The idea is to just see how much range can you produce before you start to feel the front edge of that stretch. If there's any sensitivity, you're usually going to feel it kind of right in through here. So what I will do is that if I've been sitting for more than a half hour, I'm just turning my head, or I'm turning my head and then looking down. So if I turn my head and look down, that's going to target an important muscle that sits right at the corner of the shoulder blade, and it comes up along the cervical vertebrae, and that's called your levator scapulae. That muscle is prone to shortening and getting weaker with static positions and forward head posture. So just be mindful that a lot of times when you're experiencing pain, it's not usually because of a strain. It's usually more of a weakness, or these muscles being shoulder rolls are not as effective, in part because most of us do them really quickly. But what you can do with a shoulder roll is just do a repositioning exercise, which is up, roll it back, and then you just relax, and you just leave it, and then you just leave it alone. So you just do that one time. So up, roll it back, and then relax. So what that does is it helps with repositioning the shoulder blades, but then it also helps with movement and posture awareness. But in terms of cervical range of motion and how to improve neck range of motion, the best thing to do a lot of times is because that levator scapulae muscle is going to be a little bit, it's going to get weaker. And as it gets weaker, it gets harder for it to lengthen or shorten depending on the direction you're turning. The other thing that you can work on in terms of neck pain is just working on, and a lot of people will tend to do chin tucks, but I really just encourage people to work on looking up. And a lot of times people will kind of drive their heads up and do this. So most of us will do this and then look up. But what I want people to do is just shoulders back and then work on leaning. And just see how much range of motion do you have. Do you feel a lot of pull here? If you feel a lot of tension here, then you know your workstation, your head's coming forward. So just be mindful of that. So the challenges for many of us is that activity becomes less and less and less the more we're at our workstation, and that's usually the biggest trigger for sensitivity that we're seeing. Is that a lot of times it isn't so much that I did something and I fell and I hurt myself and now I've got neck pain, or I was in the gym, because not a lot of people are going to the gym. So a lot of times it's not because of any sort of direct or indirect trauma. It's usually from just progressive weakness over time. So movement helps, activities help, staying active, minimizing your time at your workstation. All these things can help. In terms of how often should you get away from the screen, that's a great question. I mean, I think there isn't one metric, but I always like to say the best posture is the posture that you're in, meaning that if you're in one position and you're okay with that, that's fine. But if you're in that position and things are starting to get uncomfortable, you've got to get out of that position and find another position of comfort. The aim is not to stay in that position as much as you can. And regarding screen time, I mean, it's very task dependent, but I would say that every hour or so, you should at least, divert your eyes away from the screen and do something else or do something unrelated. Um, in terms of osteoporosis with online, yes, we've been working with existing osteoporosis patients online with CIH. The challenge with new patients is that I'm not familiar if they have any of the weight bearing equipment. But if you are new to exercise, there's usually some baseline exercises that I have my patients complete for the first few weeks anyway. So in terms of osteoporosis assistance, we can get that going through virtual work first by working on developing some fitness to the joint stabilizers first, because as we progress to more weight-bearing exercises, you're going to need those joint stabilizers to be more fatigue resistant. That's a great question, and that's the challenge that we're facing with a lot of our newer osteoporosis patients who are doing it remotely. Is that the challenge is that the equipment is not available online anymore because everything is sold out. And what we were doing before is that patients were coming to my clinic, which has a pretty comprehensive set of exercises and weights and training apparatus. And so now, it's hard to find that equipment unless you already have it. So if you already have it, or somebody in your family has that equipment, it makes this process much easier. But I usually say the first 6 to 8 weeks of work with my new osteoporosis patients, we're always working primarily on developing more baseline fitness, or what we call work capacity first. But that's a great question. What kind of equipment? Great question again. Weighted exercises. So because osteoporosis is specific to bone loss, and we know that weight-bearing exercises attributes to an improvement and reduction in that bone loss, so weights are usually the most important part of this equation. So we want people to have, exercise weights that are, 15, 20, 25, 30 pounds, and progressing depending on their tolerance. But, I can attest, I don't know if anyone who's on here is a patient with the osteoporosis group and wants to share a little bit of the insight. But when we first start, most patients can't lift more than 20 pounds. And by the time, about 2-3 months in, they're deadlifting and squatting quite a bit. So anywhere from 130 to 135 pounds compared to not having ever done that before. So it's a gradual process, but it is possible. And that's usually the way it works. And so, those numbers are always subject to change depending on person's comfort zone. But in terms of exercise equipment that you would need at home, it is some more weight. Any other questions? Any other considerations?
While we're waiting for that, I just wanted to say that in medical school, we talked about osteoporosis and how you give drugs like bisphosphonates, you might give them calcium and vitamin D for people, but I didn't know that it was actually reversible till I met you and I saw the results with some of your patients, which is incredible to me, so I think that's just been amazing, seeing that, how the bones can break down, but the bones can remodel and restructure and get back to, a healthier state with physical activity and like you said, gradual weight bearing and stuff.
Yeah. So SI joint pain, so the challenge with SI joint pain is that you have to kind of dig deeper than just I have SI. Sometimes SI joint could just be from muscle imbalances. Some of it could be from disc use atrophy. Some of it could. So there's a number of questions. A number of follow-up questions with that SIJ pain. And we know that the SI joint has some movement, but it's not a lot. And whatever movement that is present, most clinicians can't accurately predict how much of that range of motion is impactful in terms of production of that pain. So what we normally do is just encourage more weight-bearing activities, i.e. walking and staying as active as possible, to work on trying to develop more strength and more balanced strength between the muscles around the pelvis and the upper and lower extremity. And that usually tends to kind of nip things in the bud. But there isn't really one specific routine or one specific formula for SI joint pain, unless you kind of dig deep and find out what else is going on. And some people will have SI pain, postpartum. So that's another population that I assist, is prenatal and postpartum patients. So SIJ pain is not unusual postpartum. How to work with clients who've been on the couch? Well, step one.
Could be me.
Yeah, step one, off the couch and into a chair. Step two.
Yeah. That's baby steps, right? Baby steps.
Yeah, baby steps. Yeah, you got to go from the couch to the chair.
Nice.
The chair to outside. So.
Right. See the light.
Yeah, see the light. But I think that the big challenge with PT is that especially in this time, is that there are a lot of other underlying issues that we need to be mindful of too. A lot of psychosocial things, a lot of isolation. So one of the things we also have to appreciate is what that person's current living environment is. How much stress are they under? Because all of those things are going to play a role in terms of how consistent they're going to be, but also how quickly they'll kind of get out of this funk. Because it's really a funk that's affecting all of us at the same time, except
right.
some of us have just better coping strategies, and so that's kind of the challenge for so many people.
Yeah. Thanks.
How does fear impact the physical body? Yeah, fear is a huge part of movement strategies. If you've had bad history with injuries and bad history with pain, it can be very challenging to kind of move out of that cycle. And there's always the brain just becomes really good at predicting the pain, even though sometimes there's no pain produced, but the brain just becomes so good and so adaptable at predicting pain that sometimes that can be a big trigger. And in certain instances, you can't shut that off with therapeutic exercise. Sometimes it takes body work, it takes working with other professionals who can help you kind of conceptualize and contextualize the true nature of that sensitivity.
I think there was also a question from Angela about shoe orthotics.
Okay, and what was the full question?
So she said, "What are your thoughts on shoe orthotics? Other PTs have advised to not use orthotics."
Depending on, if you have a true foot deformity, then yes, I think orthotics and inserts can be very helpful. If there's no, if you just have what we call pes planus, which is flat feet or high arches, sometimes just working on strength and getting out of that mindset that you need those sometimes can be just beneficial. But I would say I always err on the side of conservative management first. Lots of exercise, lots of foot drills, lots of foot strengthening, balance, coordination exercises. If those fail after 3 to 4 months of doing those, then orthotics are usually going to be more beneficial in terms of helping unload some of those areas. But a lot of times, pain is usually more a common thread when there's weakness involved, rather than something too tight or something too fixed. In terms of eating and movement,
you know I'm always thinking about food, right?
I'm always thinking about food too. But the beautiful thing about nutrition is that there's so many professionals who this is their wheel well. So I don't really address a lot of nutrition in terms of PT management, because again, it's outside of my scope of practice. And
I'm just wondering about the timing, like not what you're eating, but the timing in relation, like, is it better not to eat right before your exercise? Is it better to eat?
It depends on the food. If it's a simple sugar that you can, if you eat an orange and you can go and exercise, it's not a big deal. But if you eat, a steak and then you go exercise, you're not going to feel very good. But it's doable, but you just won't feel very good. Because it just takes a lot longer to break that food down. So you want simple things that you can break down, like peanut butter.
Your energy is going to the digestive tract versus
your energy is going to be going exactly. And so some of that blood that should be going to fueling your muscles is going to be diverted.
Okay, that's good. Let's see. Did we get to? You talked about Lori's question, heel and foot pain? I'm not sure.
Heel and foot pain. What was that one?
Lori asked, what can you say about heel and foot pain? Lori, do you mean like plantar fasciitis or something else? Maybe you could call in. I think there's a way to raise your
So
hand on here.
in terms of if it's plantar fascia pain, we advise. So yeah, so with plantar fascia pain, you know, what we advise is that less of stretching and more of gradual strengthening, because with plantar fascia, the challenge is that the fascia itself is a non-contractile structure. So stretching it just aggravates it even further. And so what we need to do with non-contractile structures is just improve their load tolerance, right? So by increasing load tolerance, you basically adjust the way that structure behaves, but also you build more robustness around it. Foot pain after a lot of standing. Great question. Again, it's a very specific question, but I mean, there's so many different avenues to that. It could be weakness to the hips. It could be if you're standing for a long time and you're shimmying to one side, then you may have to just work on distributing your weight a little bit more evenly, standing a little bit wider base of support. You'd have to kind of get a thorough understanding or appreciation of that with more in-depth questions and follow-up questions. Same thing with the Achilles tendon. I don't recommend stretching it. I usually recommend loading it rather than stretching it and just working around it. So if it's really painful, if a condition is really painful, you want to work on loading and strengthening the surrounding structures while that area calms down. If it's pain after doing activities, then that usually means that you're creating more sensitivity as you're doing activity, which means that it's a loading issue. So you want to start working on gradually increasing that load and gradually improving the way that structure behaves. But if it's really, really acute and it hurts all the time, yeah, you're better off just strengthening and working on all those other structures first.
I just wanted to highlight what Kathleen said. She said that a little bit earlier in the chat. Kathleen's been working with you for over a year, and she's wearing a 25-pound vest now for squats and leg heights. I need to get on Kathleen's program here. Said Dr. Hiza is a great nudger and keeps one progressing, and working with him and getting stronger has been a bright spot during this pandemic. So thank you, Kathleen, for highlighting that. And yeah, how do you work with people that are either afraid to start with a fear, like you said, they're on the couch, not sure where to start? How do you figure out, how fast to go with people? Versus...
And that's all based on, what we were talking about earlier. Really appreciate where they are currently. And so spending a lot of time and listening to their concerns and listening to where they are, listening to, their past exercise history, that's a really important place to start. If someone doesn't have a good exercise history, you don't want to start ramping up all at the top. You want them to really have a way of gradually building that confidence within themselves. And so I don't really, when I'm working with new patients who don't have good exercise history, I really kind of create almost like an open-ended process, right? So they've got 3 or 4 routines and they just do it as often as they can during the week. Mm-hmm. And it's not necessarily like, I want you to do this 3 times a week for 3 sets of 10, because if you've never done, or if you've never done any sort of structure like mm-hmm. that, that can be a very daunting, a tall order. And if you're already under a lot of stress, especially with the current climate where everyone's under a lot of stress about a whole bunch of other deadlines and a whole bunch of other challenges, you don't want to add any more challenges, any more deadlines to that. So there needs to be some way for people to have a smoother entry into movement, into activities. By having that kind of self-determination and self-reliance, you can start working on increasing people's movement habits without necessarily forcing them to defend and not necessarily continue with those movements. So yes, it depends on the exercise history, depends on where they are currently, and it depends on how much experience they have with movements.
We just get to some questions from a few minutes ago. Dr. Stan asked, what are your thoughts about a mostly plant-based diet, might be a nutrition question, to reduce the inflammation seen in neck, back, and shoulder pain?
I'm not sure in terms. I haven't seen too much literature on the efficacy of just the plant-based diet in terms of reducing inflammation, but I do know that there are litany of factors that can contribute to sensitivities, including central nervous system response and central nervous system health. And so I think that anything that promotes a healthier central nervous system is going to promote a healthier pain response as well. And so, if diet is one thing that is beneficial, I'm not sure in terms of the evidence how effective just a plant-based alone is, but I do know that overall health and overall
yeah, just one of our patients with arthritis cut out all sugar, and then their arthritis went away from that, and they were able to do more movement. I think that sometimes it's not about what we eat, but it's about what we don't eat. Sometimes it's
Right.
like avoiding the processed foods,
Yeah.
what we call the SAD diet, the standard American diet, with lots of sugar, overly processed foods. And then that kind of forces you, if you cut back on those foods, it's like, oh, let's actually eat real food. Let's eat some plants, eat some fruits, vegetables. Let's eat some plant or animal-based protein, healthy fats. So I think in that way, you're kind of looking more at not necessarily a plant-based or animal-based kind of thing, but it's more about how do you reduce inflammation? How do you eat real foods that have nutrients in them to do that? Araceli asked about knee pain. Any recommendations for knee pain in particular?
What we're seeing depending on the type of knee pain, if it's just idiopathic, it can be just a matter of strengthening the hips, because we know there's a strong correlation between weak hips and knee sensitivity. So it usually, the pain itself may not be the knee pain may not be the root cause, but pelvis and hip muscle length length tension.
Maybe Araceli could type in a little bit more about that too. A question from Facebook. Thanks, Araceli. Question from Facebook: have you worked much with people that have sensory processing issues?
We all have. If you're in pain, if you've been dealing with chronic pain, you have sensory processing issues. That's kind of the hallmark of chronic pain, is that the way you perceive pain is unique to you, and sometimes it can be because of the way your body's interpreting that information and creating kind of that fight or flight response, sometimes unnecessarily. So yes, in terms of that respect, yes, but in terms of any specific neuro conditions, you'd have to kind of dig deeper and ask follow-up questions.
Great. What is load? Laura was asking.
So load is any weight outside of your own body weight, in addition to your body weight. So if I pick up 5 pounds,
right here,
that's load. If you've got 8 pounds, that's load. So any load is just weight. It just means, it's a fancy term for weight. Just add more weight and gradually increase that weight. And that's what and from an osteoporosis standpoint, that's how those cells determine when to lay more bone matrix down or when to reduce that. Is that by adding more load, you stimulate those cells that build bone to actually do their work, because the cells that kind of rebuild or remodel bone, they keep going regardless of whether there is any stimulus to tell it to stop or not. And so that's a normal process. And so osteoporosis and osteopenia, these are normal processes that take place in our bodies, because bone is a living organism. It's just that when we don't add extra, when we don't apply load, and when we don't apply stress to those areas, it doesn't stimulate the cells that do the actual laying down of bone matrix to actually do what they're supposed to do. I missed that last question. What was the other question?
Let's see. I think, okay, on inflammation in general, what do you think are the best sources of information that are data and science-based? I answered PubMed. That's where I go for a lot of research. That's what Jane asked. Thanks for Jane for the question. Any other sources you think would be helpful there for inflammation?
PubMed for me tends to be the most
most resourceful area for me to kind of go
I mean, we
to.
know that physical therapy and movement in general is going to help with lowering C-reactive protein levels. It's going to help with, reducing inflammation overall. And you can see that either in lab markers, but also clinically. Irene was saying that she's been working with you for about 2 months. It's been great working with him. Dr. Hughes
Hi,
is
Irene.
empathetic and listens. And, I think it's really important to that's a really important point. Thanks, Aaron, for bringing that up. I mean, empathy and listening and understanding what the person's saying is just as important as showing the exercises, right? Because you have to know where that
Right.
person is.
Yeah.
If you would just
And
say about that,
Yeah, and I think that's the challenge that we were talking about earlier. That physical therapy, most people think physical therapy is I go, they give me, and I leave.
Yeah.
And
yeah.
that's not how I practice physical
I would
therapy.
say you're a holistic physical therapist.
I try to be holistic, and I think working with CIH kind of even further kind of moves that needle towards that, because working with CIH has always been, or working with an organization like yours has always been something that I've desired to kind of get into, because I appreciate there's so many different aspects to health and well-being that can impact performance, can impact pain, can impact, perceived movements and chronic pain, that if we don't appreciate those other areas, we can miss a whole lot of information.
Yes.
Exercise for sciatica, great question. So we just got actually new emerging info that just came out not too long ago, maybe about a month or two ago. And what we're finding out is that sciatica typically will get better on its own, in about between 12 to 28 weeks on its own, even if you didn't do anything. So we're seeing that, it's just a constellation of symptoms, but with sciatica, less is more. So doing things that don't irritate it is going to go a long way in terms of improving the symptoms. But from a physical therapy standpoint, we're starting to get more information that letting that process just kind of take its course rather than trying to intervene is a lot more beneficial. And then obviously looking at some ways to modify other factors like staying active and doing things that don't necessarily trigger that response is just as important. But usually what we're seeing now is that sometimes it's best to just leave it alone.
Got it. So then the body will start to correct itself a little bit.
Right.
And you see that with sciatica a lot. See people kind of head right to the X-ray or right to the steroids, different type of thing. But sometimes the body, that's their sign to rest and kind of readjust. And then once you're done with that sciatic flare, you can kind of see where the underlying issues might be after the flare is done.
Right. Yeah. So and I think that's the other reason why working with a group like CIH is so important, is that we, when you're all on the same page when it comes to managing symptoms, but also educating patients on what to do next, and not necessarily electing to get a scan right away, because scans don't always show the full picture. And what I appreciate working with all the professionals at CIH is that they get that aspect, right? It's something that is kind of ingrained in the culture there, is that let the body do what it needs to do, and along the way we'll keep nudging it rather than let's just move into this whole different direction, and let's take over how you kind of process all this.
The body has a chance to heal itself, right?
Yeah,
that's what we're trying to do.
Right. I think that's our goal, is really let the body
We're
try
on
to
the
heal
same page
itself.
with that. I think just to get to a few more questions, almost 1 o'clock. So this is great,
Okay.
Dr. Hiza. Thank you so much. Angela was saying, I believe Angela, yes. Any issue using small weights on the wrist while walking?
If you don't have any underlying issues, not a big deal, but it can add a little bit of distraction to the ligaments in the wrist. And if you don't have any underlying issues, it's not a big deal. You'll just feel a pretty good tug there the longer you walk, and you may notice a little bit more force production. But in terms of long term, if it doesn't bother you, keep doing it.
Thank you. Maywish had a great question as well. Thanks, Angela, for the question. I suffer from overall body pain, neck, back, knees, shoulders, elbows. What could be the potential reason, and how you design a physical therapy program for people like me? So that's thank you for that question. Yeah.
Great question. I think again the challenge is, like we said earlier, like it's very the the process is very unique it's individualized, right? I think appreciating that, stress can be a part of this, unresolved trauma can be a part of this. And so you really kind of have to dig deeper and kind of work one-on-one to kind of figure out what else is going on. I wish I could just say, hey, do these things and you'll be fine. But I think it's really appreciating where they are currently in terms of exercise, movements. Have you been doing anything on your own to try to address it? You really you have to kind of dig deeper and find out what else is going on.
Yes, and using a functional medicine approach, using a functional movement approach to get to the root cause of why you might be having maybe that overall body pain. Pain from a functional perspective is a sign of inflammation, right? There's something going on. There's inflammation. There's what we call mitochondrial dysfunction. So what Dr. Hiza does, and I've been working with him too, as in terms of like strengthening my system, is using graded or loaded exercises eventually to increase your mitochondria, which you do through basically graded movement. I think there's definitely, from a functional medicine perspective, pain is about a mitochondrial dysfunction. So increasing that energy, increasing your muscles' capacity to make ATP, to make energy, will reduce pain. And then we also have to look at the gut, we have to look at hormones, we have to look at structure, and we have to look at your immune system and metabolism. So all those things are really important there.
And they're all related.
Right. How does acupuncture, how does PT relate to acupuncture? Is there overlap there? Is there a symbiosis there?
To me, I think there's a symbiosis. I think acupuncture can be for a number of reasons, and I'm sure Dr. Wong can go into that into more detail. But for me, I think that working on calming things down, that's just one way to calm things down, right? So if you've got chronic pain or if you've got acute pain, calming things down so that the central nervous system can start to interpret this new information is important. And acupuncture is just one modality to try to work on reducing that. I don't think that there's passive modalities is the only thing you can do to work on reducing that. It has to be in conjunction with self-reliance and educating people on.
I agree. I think acupuncture is a great kinetic therapy to start with, and I think it's good to maintain it. I think having the active kinetic therapy in between those type of acupuncture sessions is really critical to maintain that improvement. Just like if people are doing exercises, and I've been to traditional physical therapists before as well, before I met you, and it was kind of like they're good physical therapists, nothing against that at all. I think the issue is that sometimes it's like you do feel more like a passive person that someone else is doing something to you, as opposed to you have control over your own body, kind of like move this way and kind of thing. So I think doing these exercises and kind of, like you said, getting educated on what the root causes are of why someone might be in pain, so you understand it, you understand not only the exercise, but the lifestyle that you need to do, the lifestyle you need to change in order to prevent that in the future.
Precisely. And I think that's where it kind of comes back to, that roadmap to managing pain is that, you really, the education component is so important. And the patient's education component is so important. And without that education component, it's very hard to nudge people in a different direction. And certainly, addressing underlying issues and resolving those underlying issues, like, metabolic issues and chronic pain issues and other sensory issues is just as important in terms of overall health and well-being. But this is just a great chart up here that a few colleagues put together that I like to share with other people, to just kind of look at what is it that PT and how can PT and what does PT do in terms of addressing pain and how to move forward with that. So hopefully this is also beneficial and useful.
I really like that chart where it says how to address musculoskeletal pain irrespective of body region, right? We know the body is connected, right? So, if I have foot pain, it might be a back issue or a hip issue. And, if there's like a headache or a neck pain, that might be a postural issue from the core, right? So it's sort of like, you have to look at the whole body. You can't just isolate one area and do exercise in one section.
Right. And this, I mean, and this chart also highlights the importance of, you know, not chasing the pain, because the pain itself may not be the true root cause of it. And if you haven't done all the other, you know, steps in this chart, it's very difficult to be able to relay and convey that information to your patient as well. It's just challenging if you don't appreciate any, you know, possibility of underlying pathologies and comorbidities. You know, then you really can't have a conversation with that person that's specific to them. And if you're just going straight to exercises.
So we're going to wrap up here. It's 1 o'clock. Thank you so much all for attending.
Thank you
Dr.
all.
Hiza. This is great. Learned so much. Neck and shoulders feel better already. And if you'd like to make an appointment with Dr. Hiza, you can reach out to a CIH, to either your wellness coordinator. Nichelle is the head wellness coordinator. You can talk to her. You can just call our office. And then Dr. Hiza will be here on the 10th of July. Starting then every Friday, and then sometimes I think someone was asking about in-person visits, so that's another piece there. But we're gonna have another session to talk more about movement, because I think it's so important. You know, we're all kind of in our heads all the time on Zoom, and I think it's important to really get back into our bodies, you know, as well. So Dr. Davis will be here next week talking about biotherapeutics on the 9th of July, and look forward to seeing him there. But thank you so much, Dr. Hiza, and this has been wonderful, and we'll see you very soon.
Thanks for having me. Appreciate it.
Thanks all.